This video is for training on the new diagnostic requesting system in WebV, which is used for requesting blood sciences, microbiology, and radiology. To make a request, open the patient record and go to the main menu, the patient menu, requests and referrals, and select diagnostic requesting. This will display a table of any requests that have been requested, collected, or completed for the last 7 days. To make a new request, click on the plus and select the relevant diagnostic request. Blood sciences and microbiology requesting are done nearly the same. Either select the location from the list or type the name of the location to filter the list and select it, then do the same for the clinician. Once you've selected these, you will be presented with the Create Microbiology or Blood Science Request panel. All sections with the red symbol are mandatory, which must be entered to submit your request. Click in any section to enter information or edit any information that has already been entered. For blood sciences, click Investigations and select All Tests. Click any test you wish to add to the list. You can also change the specimen type by clicking in the Specimen Type field and clicking on a different specimen type. Once you've selected your test or tests, click on the tick. Tests that have been recently requested will get an alert. Click the cross to remove the investigation or the tick to continue with the request. If you need to edit your selected tests, click on Investigations. You can remove any added tests by clicking on the cross, or to add more tests, click on the plus. For microbiology, click Investigations and select a specimen. Then select the anatomical site, and then finally the diagnostic profile. If you need to change the microbiology request, then click back on Investigation and choose a new microbiology request. Once you have added your request, enter the clinical details by clicking into Clinical Details. Enter the clinical details for the request, and if relevant, do the same for patient comments. If you need to change request options, you can click in Priority and choose a different priority for the request. Add a required date by clicking in Required Date and selecting a date, then clicking the tick. And clicking the toggles on to mark that the patient is either pregnant, an infection risk, or a private patient. Click the tick to submit the request and view the summary. If you need to change anything, click on the arrow to go back and update the request. Click the tick on the summary to submit the request. The request will have been added to the requested table. If you are collecting the sample later, then click on the tick to close the panel. If you are taking the sample now, then click on Print and select Now. A picture of the implement or bottles needed will be displayed. Click the tick to acknowledge, then select Form. Select the printer you wish to print from, and the form should be printed. If there are any issues with the printout, you can click on Retry to retry printing the form from the same printer, or click on Cancel to go back to the table. If the printout was successful, then click on Printing was successful, then click on the tick to close the panel. If you are printing off a request that has already been requested, then select it in the table and click on the menu and select Print. Then select either Now or Later. If you select Later, then you'll need to select a date and click on the tick to confirm. Then click the tick to submit. To cancel a request, select it from the table, click on the menu and select Cancel. click the tick to confirm the cancellation or the back arrow to go back.